Deep brain stimulation is a widely known therapy among people who suffer from tremor. This has been around for about 30 years now, and it's a procedure that includes the implantation of electrodes within the brain and connecting these by means of subcutaneous wires, that's wires that travel underneath the skin, to a pacemaker, which instead of driving the heart is driving the brain. So it's a neural pacemaker. And although we say it's a stimulator, what we're actually doing is inhibiting a circuit within the brain that is driving a symptom such as tremor. More recently, there's been a lot of information going around online on MR Guided Focused Ultrasound, and this is a novel way of performing a lesion, by which we mean we can ablate very precisely the part of the circuit that is causing the problem that is driving the symptom of tremor. And some people may think that this is a radical thing to actually lesion a part of the brain to treat a disease, but it's an idea that's been with us since the 1940s. And we've actually been creating lesions for over half a century using radiofrequency ablation. Previously, we had to make an incision, we had to make a burr hole to drive a probe to the target, and then to use the tip of that probe to pass a high-frequency electrical current through the brain, and that heats the tissue around the tip of the probe and causes a lesion, just in the same way as you would heat an egg and cause coagulation of the protein in the egg, turning the transparent egg white into the non-transparent egg white. The amount of tissue that is destroyed or that is ablated during this procedure is absolutely tiny. We're talking about an area about a quarter of the size of my little fingernail, compared to the brain, which is 1.5 kilograms in weight, roughly. It is really a tiny and minute portion of the brain. I think the evolution of MR-guided focused ultrasound really takes an old and proven concept, which is that a stereotactic lesion can provide fantastic benefit, but allows us to do this in an incisionless way without the need of lifting a scalpel, lifting a knife, and creating an incision and creating a burr hole.